If your doctor told you 140/90 is fine for your age, they may have just signed off on the most dangerous number in your body right now. Here is the part nobody is telling you. After 60, the rules change completely, and the blood pressure range your doctor called acceptable 5 years ago is now quietly doing damage that will not show up on any test until it is too late. 1 in 3 people over 60 who have a stroke had blood pressure that their doctor described as managed. 1 in 3. Not uncontrolled, not ignored, managed. And what I am about to show you changes everything. I am Dr. Helen. In 20 years of practice, I have seen this work when everything else failed. So let me ask you something honest. When was the last time your doctor sat down with you, not for 8 minutes, not while typing into a computer, but actually sat with you and explained what is happening inside your arteries right now? Because if that has not happened lately, you are probably operating on outdated information. And that gap between what you think you know and what is actually true is exactly where the danger lives. Here is what is really going on. When you were 40, your arteries had a lot of give to them. Think of them like brand new garden hoses, flexible, smooth, able to handle pressure spikes without any drama. But after 60, those same arteries have stiffened. They have been under pressure for decades, and now they are more like old rubber tubes, brittle, thickened, less forgiving. When your heart pumps and the pressure spikes, there is nowhere for that energy to go. It does not just pass through anymore. It slams into those stiff walls. Now here is the number your doctor may not have updated you on. The American College of Cardiology updated its guidelines, and the research behind them is stark. For adults over 60, a systolic blood pressure, that is, your top number, above 130 is now considered elevated. Not 140, not 150, 130. And every 10 points above that threshold, your risk of a cardiovascular event goes up by roughly 20%. That is not a small margin. That is not something to watch and wait on. But here is the part that really needs to sink in. Your diastolic number, the bottom number, starts to actually fall after 60 in many people. And a wide gap between your top and bottom number, what doctors call a wide pulse pressure, is one of the clearest signs that your arteries have lost their elasticity. It is your body sending up a flare. And most people have no idea what it means. So when someone says, "My blood pressure is 148/72, and my doctor says it is okay for my age," I want you to understand what you are actually looking at. That wide gap, that high top number. That is a stiff arterial system under serious stress. Age-based leniency on blood pressure is one of the most dangerous myths in medicine today. Your arteries do not care how old you are. They only respond to pressure. Now let me give you what actually moves the needle. And I mean that literally. What shows up on your cuff within weeks when you do these things consistently? Step 1. Take your reading the right way. The first thing, and this is the one most people skip because it sounds too simple, is timing your readings correctly. Most people take their blood pressure in the morning, right after coffee, right after rushing around getting ready, maybe even while still feeling stressed. And then they show that number to their doctor. That number is almost always inflated. The correct way to take your blood pressure is this. Sit quietly for 5 full minutes first. No phone, no conversation, no coffee in the last 30 minutes. Feet flat on the floor, arm at heart level. Take 2 readings 2 minutes apart and average them. Studies published in the Journal of Hypertension in 2022 showed that the difference between a rushed reading and a properly measured one can be as much as 14 points systolic. 14 points! That is the difference between a normal reading and a doctor calling a medication. Step 2. Cut sodium from the right places. The second thing, and this is where the real power is dietary sodium. Now before you roll your eyes and say you already know about salt, hear me out. Because most people are cutting salt in the wrong places, you put down the shaker, you stopped salting your pasta water, and your blood pressure barely moved. Here is why. About 75% of the sodium Americans consume comes from processed and restaurant food. Bread, canned soup, deli meat, frozen meals. Things that do not taste salty. The target for someone over 60 with elevated blood pressure is under 1,500 milligrams per day. The average American consumes over 3,400. So when you cut the shaker, but keep eating the bread and the soup and the lunch meat, you are barely touching the real problem. Start reading sodium on every label. That is where the actual work is. Step 3. Load up on potassium. Third, and this one surprises people every single time, is potassium. Not just reducing sodium, but the ratio between sodium and potassium. These two minerals are in direct competition in your body. Potassium relaxes your blood vessel walls. It literally pulls sodium out through your kidneys. A landmark study in the New England Journal of Medicine showed that people who significantly increased potassium while decreasing sodium had drops in systolic blood pressure of up to 11 points without any medication. 11 points. Foods highest in potassium that most people underuse: cooked white beans, baked potatoes with the skin on, plain yogurt, leafy greens like spinach and Swiss chard, avocado, and bananas, though bananas are often overhyped here. The beans and the potato and the greens are your real workhorses. Step 4. Try isometric hand grip exercise. Fourth is something called isometric hand grip exercise, and almost no one is talking about it. A review published in the British Journal of Sports Medicine found that isometric resistance exercise, which means holding a contraction without movement, reduced systolic blood pressure by an average of 8 points. The protocol used in multiple studies is simple. Squeeze a hand grip device at about 30% of your maximum effort. Hold it for 2 minutes. Rest for 1 minute. Repeat 4 times. Do this 3 times a week. It sounds almost too easy, but the mechanism is real. Sustained muscle contractions signal your blood vessels to dilate and stay more relaxed over time. This takes about 4 to 8 weeks to show measurable results, but it is measurable. Real studies, real numbers. Step 5. Fix your sleep. Fifth is sleep quality, and this is the one people resist the most because they do not see the connection. Here is the connection. During deep sleep, your blood pressure naturally dips, called nocturnal dipping. Your body uses that window to repair your vessel walls and reset your stress hormone levels. When sleep is fragmented or short, that dip does not happen. Your body stays in a low-grade stress state all night. Over weeks and months, this shows up as persistently elevated daytime readings. Sleep apnea, which is extremely common and underdiagnosed in people over 60, can raise systolic blood pressure by 10 to 15 points on its own. If you snore, if you wake up tired, if your partner has ever mentioned that you stopped breathing in your sleep, please ask your doctor for a sleep study. That one test could explain everything. Step 6. Walk at the right intensity. Sixth, and I want to be very specific here because this is where most people get it wrong, is exercise. Walking is good, but not all walking is equal when it comes to blood pressure. The research is clear that moderate intensity aerobic exercise for 30 minutes, 5 days a week, produces the most consistent blood pressure reductions. Moderate intensity means you can talk, but you cannot sing. You are working. You are slightly breathless. A gentle stroll around the block at a pace where you could recite a poem without any effort is not the same thing. That pace feels comfortable, but it is not producing the cardiovascular adaptation you need. Push yourself a little. That is where the benefit lives. Step 7. Address chronic stress directly. And seventh, this is the one that nobody wants to hear, but I am going to say it anyway because I care too much not to, is chronic stress. Not the stress of a hard week. I mean the ongoing, background-level tension that many people over 60 carry without even noticing it anymore. Worry about health, financial strain, loneliness, grief, the loss of a spouse or a close friend. These are not soft topics. They are physiological. Chronic stress keeps your cortisol elevated. Cortisol tells your kidneys to hold on to sodium. It tells your blood vessels to stay constricted. It raises your baseline blood pressure 24 hours a day, regardless of what you eat or how many steps you take. I am not saying fix your stress and your blood pressure fixes itself overnight. I am saying you cannot out-diet or out-walk a body that is in constant survival mode. If that resonates with you, if you recognized yourself in that description, please do not ignore it. I want to speak to you directly for just a moment. I have sat with patients who did everything right. They took their medication, they went to their appointments, they believed the numbers their doctors gave them were safe enough, and some of them still had strokes. Not because they were reckless, because they were working with incomplete information. You are not here by accident. You watched this video because something in you knows that the story you have been told is not complete. And you are right. Your body has been waiting for this signal. Now you know how to give it. I want to ask you to do two things right now. Drop your city in the comments below. Just your city. I read them. I want to know where you are coming from, and it helps me understand what you need next. And then think of one person in your life, a parent, a spouse, a friend over 60, who needs to hear this today. Send them this video. Not later, right now. That one share might be the most important thing you do today. Thank you for trusting me with your time. Take care of yourself. You deserve to. This video is for educational purposes only and does not replace the advice of your personal physician. Always consult your doctor before making changes to your diet or lifestyle.